We are joined, of course, by ABC Chief Medical Correspondent Dr. Jen Ashton. Let's take a look at the latest coronavirus case numbers from Johns Hopkins University. Now more than 90.2 million diagnosed cases of coronavirus worldwide, at least 22.4 million of those here in the U.S., and now more than 374,000 American lives lost.
And so much focus, Dr. Ashton, on, the slow vaccine rollout. We keep seeing record numbers, but it's important to know why it's so important. Even if you recover from COVID, it's still important to keep these numbers down.
Exactly, TJ. And we've spoken before about the risk of death, and certainly that toll, 374,000. That's not a statistic. Those are real lives. So we're talking about deaths, we're talking about cases, we're talking about vaccines, but a new study also bringing to the light why we need to care about preventing this, the long-term or lingering effects. This was published in The Lancet. They looked at 6 months after people who had COVID-19 and found even though what these consequences are still remains a little ambiguous and unclear, they found 76% of people had at least one symptom half a year after the onset of their illness. More than 50% of patients had lingering abnormalities on chest imaging, so things like chest x-rays. And they found the most common symptoms: fatigue, muscle weakness, sleep disturbances, anxiety or depression. These are debilitating, and a lot of people, millions and millions of people, suffering with them.
Yeah, and we've all heard people say, I just want to go ahead and get it and be done with it and then have immunity from it. But you say, and you've said, this study is a clear reason why it's important to prevent it.
Exactly. So when people are talking about the vaccine and they say, well, what's really my risk of dying? You know, in medicine, we have a saying, there are worse things than death. Your risk of dying of COVID is about 1 in 1,000, and obviously that's tragic. But when you look at these numbers from this published study in The Lancet, 76% of people 6 months later, if you have to work, if you have to go on with your life, this brings to the forefront why it's so important to prevent this disease in the first place.
All right, Dr. Jen, very important indeed. We'll be checking back in with you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.